Hi everyone, I'm Wanya Doc. In this video, I'm going to discuss about cough. If you like this video and benefit from it, hit the like button, comment below, share and subscribe. What is a cough? A cough is a sudden, forceful hacking sound to release air and create irritation from your throat and also to release irritation from your airway. May have causes that are not due to disease. These are the normal causes of cough. Example is when you are clearing your airway. Number two, when you are clearing an irritant from your throat or from your airway. These irritants include smoke. We have gases and other tobacco smoked and maybe irritants like perfumes. Another reason you may cough normally is when you have an aspiration. An aspiration is when you food or drink enter into the wrong pipe. Cough may also have other reasons that are due to an underlying disease. These diseases, mostly we have respiratory diseases. A cough is the most frequent symptoms of respiratory disease. Other reasons why we have cough is that we have other diseases that are not respiratory diseases that can cause cough. A cough occurs when there is a stimulation of nerve endings. Now, these nerve endings are located in your innermost part of the throat, of the voice box, of the trachea, that is a windpipe, and also the bronchus and the small bronchus. Cough can exist in two types. We have an acute cough and also we have a chronic cough. An acute cough is defined as a cough that is present for more than 3 weeks or less. A chronic cough is a cough that is present more than 4 weeks in children and also lasting for around 8 weeks or more in adults. A chronic cough can be disturbing, can result to lack of sleep, and also a chronic cough can usually result to exhaustion. A cough can present as a cough without other symptoms, and also it can present with other symptoms. What are the common causes of cough? One, we have around more than 18 causes of cough. One, we have postnasal drip. Postnasal drip happens when your nose or your sinuses produce excessive mucus. This excessive mucus may drain down into the back of your throat, irritating your throat and also triggering a cough reflex. When you have an upper respiratory infection like sinusitis or common cold, this may result to that postnasal drip resulting to cough. Number two, we have laryngitis. Laryngitis is the infection and the inflammation of your voice box. Number three, we have laryngeal cancer. And number four, we have whooping cough. Number five, we have croup. Croup is the infection and the inflammation of your larynx, trachea, and it may involve the bronchus. I've done a video of croup. You can check it in my YouTube playlist. Cough that happen to originate from your larynx usually is harsh and painful. It also exists with other symptoms like hoarseness of the voice, and also it may be accompanied by what we call a stridor. A stridor is like a whistling sound that comes from your airway. Number seven cause of cough is a disease we call tracheitis. Tracheitis is the infection and the inflammation of the trachea. This is what we call the trachea. A cough that present from tracheitis usually present as a cough that is originating retrosternal. retrosternum is behind the breastbone. Reason number 8 why you might have a cough is a disease we call chronic bronchitis, also may be known as COPD. COPD is a combination of chronic bronchitis and emphysema. Chronic bronchitis is a long-standing inflammation of the major airways or major bronchus, those bronchial tubes, resulting to what we also say is a cough. This cough may be dry or productive. Mostly people who have chronic bronchitis are smokers or people who have recently quit smoking. Chronic bronchitis cough usually is worse in the morning. Also, we have another disease which we call bronchiectasis. Bronchiectasis is the abnormal dilatation of the bronchus. People with bronchiectasis produce a lot of sputum, which is smelly, and also is usually triggered by change of posture or change of position. Another reason why you might have a cough is asthma. Asthma is an airway disease in which your airway narrows, your airway swells, and also your airway produces an excessive mucus. This narrowing and swelling and production of excessive mucus result to the blockage of the airway tubes, resulting to airway obstruction. Other reasons why we have a cough, we have a foreign body. Children and adults may aspirate a foreign body. A foreign body will present with cough. Another reason why you might have a cough is that you have a bronchial cancer. Cancer of the bronchus may present with a persistent cough which has blood. And the other reasons that you might have a cough is that we have a disease we call bronchiolitis. Bronchiolitis is the infection and the inflammation of the smallest bronchial tubes. Bronchiolitis is caused by a virus which we call the respiratory syncytial virus. Bronchiolitis can occur in any age, but mostly it affects infants. Also, we have another cause of cough, which is pneumonia. Pneumonia is the infection and inflammation of the lung tissue. Pneumonia mostly is caused by bacteria. You can watch a video I've done on pneumonia. Pneumonia presents with a cough. Sometimes this cough will start as a dry cough and later becomes productive, producing mucus. The mucus that you produce in pneumonia depends with the specific bacteria that has caused your pneumonia. Some bacteria may produce green sputum, others may produce rust sputum, and others may produce red currant jelly sputum. Another cause of cough is TB or tuberculosis. TB can affect any part of your body except your nails and your hair. So when you have lung TB, this TB present with a cough which is persistent, productive. This sputum may contain blood. Other reasons why you might have a cough is that is lung cancer. When you have lung cancer, you present with a cough that has blood. Another reason why you have a cough is as a side effect of the high blood pressure drugs that are known as angiotensin converting enzyme inhibitors. These drugs include captopril and enalapril. These drugs may also be used to treat heart failure. They cause cough to some of those patients that are using those types of drugs. Another disease that can cause cough is a disease of the digestive system. It is called the GERD. GERD is a short form of gastroesophageal reflux disease. Gastro is the stomach, esophageal is the esophagus. Reflux is the throwback of stomach acid and other stomach contents into the esophagus and into the throat. This acid will end up causing constant irritation of the throat and triggering a cough. And Last one, we have allergies. Some of the people who are allergic to some of these allergens can have a cough. How do we diagnose cough? Cough is diagnosed by one, your doc will take a medical history where your doc will ask you about the duration of the cough, timing of the cough, other associated symptoms that are accompanying the cough, and also your doc will do a physical examination on you. Physical examination may involve listening to the chest and also other procedures that may relate to the specific disease. Another issue, your doc may also order some tests. These tests may include the blood test. They may also include the sputum test. They may also include the imaging test like an X-ray, and also your doc may also perform lung function tests. Lung function tests, we have a test we call spirometry. Other issues that may arise is that the disease that is causing the cough will be investigated further depending on how you are presenting. How is cough treated? Cough is treated according to the underlying cause. If your cough is caused by asthma, you will be given bronchodilators, respiratory modifiers, other treatments that may be used to treat cough. If you have an allergic cough, you may be needed to be given cough suppressants and also drugs that will modify your immunity, or allergy drugs. When you have a cause of cough, which is that problem of the stomach, where the acid is flowing back into the food pipe, you may need to be given antacids and also drugs that block production of acid. I'm Wahinya Doc. For more content like this, subscribe. Thank you.